Health systems are essential for protecting, restoring and improving the health of people. Europe has a long tradition of organising health systems based on solidarity and universal access. But health systems face important challenges. More chronic conditions, growing shortages of health professionals, spiralling costs, high prices for new technologies, increasing inequalities, inefficiencies and waste together with budgetary constraints. In this context, policymakers have to make difficult choices. They are under pressure from various groups, stakeholders, advocates, lobbyists and public opinion. Scientific evidence and experience from other countries can help to inform and steer their decisions.
Europe has been a pioneer in implementing universal health care right back to the 19th century. But it's a tremendous natural laboratory because the countries within Europe have implemented universal health care in different ways. They have much that they can learn from each other, and particularly as they go forward, they share many common challenges of aging populations, multimorbidity, complexity. So therefore, they can look at what each is doing, adapt it to their own circumstances, and also provide a test bed for the rest of the world to look at.
Based on this idea, the European Observatory on Health Systems and Policies was created in 1998. In the early 90s, many countries in Europe started to reform their health systems. Often these reforms were based more on beliefs than on evidence. In 1996, the World Health Organization called for an international conference in Ljubljana to adopt a common set of values for health systems and promote the exchange of good practice. The group that prepared for this conference decided to continue the work.
And that was really how the Observatory came into play. Different parties, the universities, the countries that have been supporting Ljubljana, the World Health Organization, the World Bank, a number of NGOs, all came together to say, we actually want to make this a more sustainable program of work. How can we do it? So we really made it up as we went along. The different parties talked to each other, worked out a model, and 20 years later, a very similar model is still there.
The Observatory main functions are monitoring countries' health systems, analysing trends and policies, assessing their performance, and communicating relevant lessons for policymakers.
One of the recent things we did was we did a broad analysis of the whole health system where 60 people from Slovenia were involved and almost all the experts of the Observatory. And this worked really well together. We gained a lot because our experts could mirror ourselves with other countries, with other experts, and what we really got was in-depth analysis, which is serving now to do some further steps.
The government of Finland decided to start a major health and social care reform. We needed an international expert panel in the beginning phase of this reform to evaluate the potential impacts of this reform based on experiences from other countries. And so we contacted the Observatory and they put together a fantastic expert panel very quickly, and they did a fantastic job for us. They wrote a report based on the information that we had about a year ago, and it turned out to be very helpful when we finalized the features of the reform. And we have come back to that report many times ever since.
The Observatory's objective is to act as a bridge between the worlds of research and policy. Its core mission is knowledge brokering and transfer of evidence across countries.
To us, the key on being successful and effective relies very much not only on the quality of the evidence, of course, but also on the policy relevance and particularly the timeliness. So, how do you tailor that evidence? Policy briefs, policy dialogues, focus briefings to the different needs of the policy-making process, from developing options to communicating them, to implementing them. And also, as important, identifying those windows of opportunity where the evidence is going to make a difference.
Besides translating the evidence into policy lessons, tailoring them to the needs of policymakers, and timeliness in communicating, trust is another key ingredient. It requires a good understanding of the complexities and pressures policymakers have to face.
Policy research and advice are not expected to produce the solutions. They are meant to provide accurate, reliable and credible knowledge to inform public policy.
The Observatory's core mission is also reflected in its governance model. It is based on a partnership of international agencies, national governments and decentralised health authorities, as well as academic institutions. Together, they steer the Observatory's priorities and activities.
Well, I think we're very lucky in that we have an amazing mixture of partners with different experience, different understandings of the policy process. And they really help us to sort of understand what it means to be making policy decisions.
To secure our health systems for the future, we need to ensure their capacity to include all people, further invest in health, and innovate the provision of health services. Today, a process is put in place to transform our health systems and make them more effective, accessible and resilient.
The European Observatory on Health Systems and Policies can contribute to this process by informing policymakers which regulatory instruments are available to them, how they work, what the side effects are, and also to provide a broad understanding of how health systems work.
This is why the Commission became a partner of the European Observatory on Health Systems and Policies. The Observatory has made a major contribution, together with the OECD, to one of our recent flagship initiatives, the State of Health in the EU cycle. By enhancing our knowledge and capacity, we can improve the performance of health systems and increase their impact on the well-being of all Europeans.
The European Observatory on Health Systems and Policies has a well-earned reputation for delivering tailored, actionable knowledge to countries, helping them to shape sound health policies and build effective health systems. At the WHO Regional Office for Europe, we take great pride in hosting this vital partnership and their work, which has not only been an essential building block for Health 2020, but is also contributing to delivering the 2030 Sustainable Development Agenda.